It is important to recognize signs of obstructed labor early on and transfer to hospital or seek obstetric opinion. Obstructed labor is failure of cervical dilatation and descent of the presenting part despite strong contractions. The woman should be encouraged to mobilize during labor as gravity aids fetal descent. Labor is established when the cervix is 4 centimeters dilated, and progress should be 0.5 centimeter dilatation every hour. Second stage of labor should not be longer than 1 hour. If there is no progress of fetal descent, stop pushing and get medical assistance. It is important to seek obstetric opinion or transfer to the hospital when presented with these problems. The midwife has a significant role in accurate assessment of the perineal tear. There are 4 degrees of tears. The first degree tear is trauma and laceration to the skin, subcutaneous tissue, and vaginal mucosa. Second degree tear is trauma to the perineal muscles, excluding the anal sphincters. There are different types of third degree tears. 3A is less than 50% of trauma to the anal sphincter, the external one. 3B is more than 50% of trauma to the external sphincter. 3C is both the anal, external and the internal sphincter tone. And fourth degree is both the anal sphincters tone and the anorectal epithelium. Tips on how to recognize third and fourth degree tears. So if you notice any trauma that extends to the anal margins, absence of puckering around the anterior section of the anus. If you do a digital examination, ask the woman to contract the muscles, and the anal sphincter will retract backwards towards the ischiorectal fossa. Palpate the anal sphincter by inserting the index finger in the anus and the thumb in the vagina. Pin rolling motion, you will feel a gap if the muscles are torn. The internal anal sphincter muscles are smooth, similar to fish flesh, and the external muscles are striated and similar to the red meat. Postnatal recommendations for follow-up. It would be recommended that women have a 6-week follow-up assessment to assess their sexual, urinary, and bowel function. In the hospitals that have the facility of rectal physiology tests and endoanal scans, that would be also recommended. Physiotherapy plays a significant role in ensuring that women are doing their pelvic floor exercise correctly. It is advisable for women to be reviewed antenatally if they've had a previous third degree tear to assess their bowel function and also their urinary function. This will help to decide on the mode of delivery.